was your day?
It was good.
Was it long, or did it feel okay?
It did feel a little long.
Okay.
It did feel a little long. I don't know if it's the weather.
Yeah, maybe.
Or
I feel like today was a little long. Yesterday flew by, but I feel like today was a little bit of a stretch. So.
Well, isn't that funny? You were busier yesterday.
Yeah, and I was on time. Like everything kept going yesterday, whereas today, like I kept getting not necessarily behind, but like I wasn't keeping up with my charting like I wanted to and stuff. So maybe that would have made a difference too.
Yeah.
Even though it wasn't as busy. Apparently busier is better for me.
Yeah. I mean, it's easier to stay on track when
you can't get sidetracked.
Right.
Yeah.
Right.
Because there's not time to get sidetracked.
Mm-hmm.
So, okay. Was yours a busy day?
Yeah, I think I saw 17.
Nice. I
think it was 17.
Yeah. Okay, that's great. Any fun stories from today? Anything you can think of that was any wins?
I mean, there's always a win.
Oh, yeah.
But just trying to think of one off the top of my head. Helping a new mom.
Okay.
Been told, it's anxiety, it's all of this, and now she's having clearer thoughts with her new diagnosis and
nice.
Just navigating through that. It's a win.
Awesome. So ADHD diagnosis?
Mm-hmm.
Okay.
And it's funny, she contacted her siblings and informed them, and already she was telling me that a sibling reached out to get help and was shut down.
Oh, really?
And was disheartening. They don't live in state. They're not in proximity to us.
Yeah.
And was shut down. And I thought that's so disheartening because we don't make up the statistics.
Mm-mm.
I mean, the genetic inheritability, is 80-ish%.
Yeah.
That's something.
Yeah.
If you're having struggles, that should be addressed. I mean, that we ask family history for a reason.
Mm-hmm. Yeah.
And that's disheartening that she has access and he doesn't have access.
That stinks.
So that's no good.
Yeah. I don't know. I can't understand why can't we get on board as, providers and help these people? You know, like I feel like we do a really good job of it here, but like you said, other places that are out of state or whatnot, they don't have that option to be able to do that. So yeah, that stinks that he's not able to get that help.
Yeah. Well, not even an assessment.
Yeah.
Disheartening that people don't have access. And then they request help and are shut down without an appropriate
assessment.
Yeah. And then, that really makes me wonder how often that happens without reasoning.
Yeah.
Without, why is there so much stigma? Why can't people get help? Why? It's surely at this point in society, we see that this is real.
It's a real thing. Yeah, it is.
It's
a real thing.
And it's not, we're not drug addicts. The majority of us are productive members of society.
Yeah, for sure.
It's a real struggle.
Yeah.
And people need help. And just because we're adults doesn't mean that the struggle isn't real. If anything, I say it's worse into adulthood because the ramifications
are huge.
Right. It's not about A's and B's. It's about
whether you got your job or not,
right.
Or you've got your kids picked up from school because you didn't forget.
Right.
Those things, those big things. Yeah, for sure.
Did you have any wins?
I did. I actually, a very similar one, but I just thought it was really cool that this gal, so she's had her ADHD diagnosis now for probably 6 months or so. She's been seeing me. And we did labs because we were going to do some HRT. And so we did some labs, and we were looking at her labs, and we kind of had wins all the way around. One, she was like, all of the things like that she's been feeling, the fatigue, the hair loss, the feeling like she can't find her words, the brain fog at work. And this gal's young, like she's not in her 50s, she's young, she's not where you'd think perimenopausal, right? And so all this stuff, and she's like, and her heightened anxiety, she said she's been treated for anxiety for the last 6 years without her ADHD diagnosis. And we have now got her on an ADHD medication that she's like, I don't have any anxiety. And then just to be able to do the labs and look at them and be like, oh, wait a minute, these things are low. And then we looked back at our gene site testing and we're like, oh, that's why this is low or that is low. And just to be able to then put all those symptoms together that she's had, and she's just pushed off because she's a working mom and she has multiple kids, and she's like, there's a reason behind all of it. And she was just super excited that we had taken the time to find that for her.
Good.
So, yeah.
That is a win.
Yeah.
When people feel cared for and listened to.
Yeah. So, and then the fact that she's like, all this time they were treating my anxiety, and it wasn't really anxiety, it was her ADHD that just was untreated.
Wow.
Yeah.
Well, that happens so often. A patient today asked me about the new non-stimulant coming out.
I had one we discussed. I had two patients we discussed it about today.
And, I can't say it.
Yeah, I can't either.
And so, and I was telling him I was kind of shocked that he had done any research. And he was like, well, what do you think? And I said, I don't know.
Yeah.
I said, it isn't even out yet. I said, it doesn't even have a brand name yet that we're aware of.
Yeah.
I said, we saw the drug reps yesterday. They're not even aware of a brand name yet.
Yeah.
I said, I just found it really interesting that he had already, had heard about it. And I was like, we're hopeful.
Yeah.
We always want a new option. And
that's what I told my two patients. We discussed it. I was like, we're excited to have something new coming out because we haven't had that in a long time.
But if it's supposed to be released in a month and it's still,
I know, right?
I
told him, I was like, I'm pretty sure it's supposed to be like in the next month or so that it's released. So I'm
with no brand name.
Yeah, with no brand name. It's okay. Hey, maybe for once we'll get one name we get to call it by.
Well, because the one that it is,
we're gonna give it an acronym if it stays
we're gonna
that.
have to, because I can't even say it.
I'm not even gonna try.
I'm like, oh.
I actually spelled it to I sent it in the little group chat on Zoom to my patient. This is what it is, because I was like, I don't know how to say it.
I'm like, I can't say it.
So what should we talk about today?
I don't know. We got some good topics.
We do. We have some good ones, and then we can hit on a couple of them. I mean, they're just there's all kinds here.
I liked this one. The neurodivergent identity, how people decide whether to claim the label and how the identity shifts over time.
Oh, okay. Yeah, because we do see people that don't want to claim that label.
Not at all.
Yeah.
Well, and I think even myself over time, gosh, honestly, I'm pretty accepting of the label overall. But sometimes people say things that make you kind of not want to tell people. Well, everybody's a little ADHD.
Oh.
And I'm just like, you have no idea what we're talking about.
I'm like, that's so frustrating. Yeah, I don't like that at
and
all.
It makes you not want to, self-disclose when people are so, they just don't, it's not a joke.
No.
The identity, it doesn't make me who I am.
No.
It's not my identity.
No.
But it is a huge portion of my life, and it's not something that's a joke, or it's definitely not an attention-seeking diagnosis, as some would, at this point in our social history, people are, oh, it's TikTok. Well, I am so glad I got my diagnosis before TikTok.
Me too.
Because I'm like, no, it's been years.
Yep.
I was an adult. It's been years pre-TikTok.
Yeah. No, but I agree. But that kind of goes along with that stigma. I feel like maybe why some providers are not willing to even go as far as testing for it is because they think, oh, their patient just seen it on TikTok, and they're just coming up with it. And so I think that plays into all of that.
I'm not embarrassed by any means. So I will tell people, but definitely it's their attitudes and how they perceive you, or my perception of how they perceive me is not always, positive.
And I feel like I will say it randomly out of the blue, I'll do something, I'll be like, oh, sorry, my meds aren't working, or it's my ADHD. And then after I say it, I'm like, oh crap, now they probably think I'm like a dingbat, Right. Because
because they look at you like that look.
Yeah. And it's fun because when I do say it and someone relates, they're like, oh yeah, and then they laugh, But sometimes you get that look and you're like, crap, what did I say that for? Because now they think ADHD, intrusive thought, just came out of my mouth, right?
Right.
So yeah.
That's what they think.
I notice when I have kids in my office and I diagnose them, the minute, some of them, not all of them, some of them, the minute I say, oh, it's ADHD, they're like, and they look at their parents like, what? Why do I have, no, we're not saying that. Because I feel like kids even stigmatize it.
They do. And have you noticed too that there's a stigma between ADHD combined type and ADHD hyperactive type? And people come in, I'm just ADD. And I go, well, that's not a thing anymore. But I'm not hyperactive. And they're worked up about not being hyperactive.
Yeah.
And I'm like, actually, the majority of us are hyperactive. It's actually, I feel like in my practice, it's mostly combined type.
I do too. I agree with you.
But they feel they just don't want to be labeled as hyperactive. They'll happily take the ADD part, but they don't want that H part, and they feel some kind of way about it, even if they show they're hyperactive the whole time they sit in my office.
Yeah.
And there's and I don't, now that's the stigma I don't get at all.
Yeah, I don't either. I think maybe that goes back to, originally, the ADHD was the little boys that were climbing the walls, and people look at it and they're like, I don't do that, that's not me. And I'm like, yeah, but it's not always climbing the walls. Sometimes it's all we can do is sit here through this visit, or sit through the meeting at work, sit through a 2-hour movie with our significant other or spouse. It's not necessarily we're running the hallways, it's that we're filling it inside, and I think that's hard to explain to people sometimes.
But just to see, they feel some kind of way about it for sure.
So I think it's interesting though, to, like just the labeling. When we label it, people get all kinds of antsy sometimes. So.
I think I don't know what I was going to say.
It was a long day.
It's a long day.
We can always circle back, because that's what we do. Circle back. Neurodivergent communication styles. Let's take a look at that one. So some of us are very direct.
Yes. I like direct communication.
Yeah. We're going to say it before almost before we think it. It's here and here.
I want to know what you want. I don't want to beat around the bush. I just want to know what you want from me.
Yeah.
I prefer direct communication. Because I don't like, I hate to call them games, but that's what they feel like.
Yep.
Trying to communicate with people when there is you can sense, like I can sense that there's some game being played, but I don't really understand why, and I don't like it.
Do you feel like that one, the directness, because the next one is info dumping, which is similar but different. So do you feel like those of us with ADHD that are direct, does that autism play a part in that, if they're the ADHD?
I think so. They overlap so significantly. And I think there is, just a huge piece of that overlap. It's hard to tell.
Yeah.
Maybe that social cue portion of the game, maybe.
Yeah.
ADHD people might get more than the ADHD person, because I don't get it.
Yeah. Yeah.
There are just times. There are literally times when I'm talking to my boyfriend and I'm literally at your office going, "Is this funny?
Yeah.
Is this because they're LOLing,
but you're not.
But I'm not.
Yeah.
And I don't understand why they are.
Yeah. Exactly.
But that happens all the time. I hear people laugh,
and then you're like.
And I'm just like, what are you, why is this funny? Because I think stuff's funny.
Yeah, yeah.
But I smile all the time. I think things are funny. I'm a happy person. Overall, I feel like I am.
Yeah.
But sometimes the communication is I just don't understand.
Yeah. I agree. So what do you think of info dumping?
I think it's a love language.
It's a love language. I love that. That's what I'm going to start saying. It's a love language. It's not info dumping.
It's not for everybody. I get it. But gosh, to have someone listen while you info dump?
Yeah.
That's a love language. I swear.
So I just started to say, I used to info dump. And then I was like, wait, I'm pretty sure I info dumped just the other night to my husband.
Well, we get so excitable about, and I know they're random things, and I know, but shoot, I feel like those are the best moments of communication.
Yeah. And I think it's great to recognize that you info dump, because I think info dumping to some people can be overwhelming.
It can be.
But for some of us, that's our way of I got to get out my whole day in like the next 30 minutes of conversation, and you're going to get 2 words in. And that's a true love language, because that other person has to be willing to just, you know. So, and I think like recognizing that you info dump is a good thing, because then you know when to info dump and when not to info dump.
I had a teenager info dump on me yesterday.
Oh, okay.
And he even acknowledged, he said, and see, I'm losing you right now. And I said, no, you're not. I'm medicated. And he has ADHD. And so I was like, no, you're wrong. I was like, I'm here.
Yeah.
I am, I may not know what you're talking about,
but I'm here.
We're talking about cowboys.
Yeah.
Great kid.
That's awesome.
And so I was like, no. He was like, I lose people. You didn't lose me. Now, had I been unmedicated, he probably would have lost me, because it was not a topic of interest for me at all, and something I know nothing about and have no interest in. But I was focused, and he's so animated that
it was fun.
It worked. But I think info dumping, I think it's a love language. I think you have to, you can't,
I'm an info dump, and I've got when I info dump, I have got all the hand actions to go with it, all the facial expressions to go with it, and my voice is going to fluctuate.
And I'm
10 different ways.
Usually if I'm info dumping, I'm pretty excitable about the topic.
Yeah.
Usually.
Yeah, I agree. Or for me, it's holy cow, this is how my day went. But not necessarily even in a bad way, but I just have lots of information to give you, and I've got to get it all out.
Yeah.
Yeah. So.
I like this one too. Executive dysfunction, not as a meme, but as a lived barrier that shapes work, relationships, and self-esteem.
Okay.
I do resonate with that.
Okay.
Resonate with that. I think my executive dysfunction has greatly affected my relationships and my self-esteem.
Okay. Yeah.
Even everyone who knows me, I think, knows that I can't keep a car clean. And that was a really soft, sore subject in my marriage.
Okay.
It was a thing. My ex-husband related my inability to keep a car clean to me being a good wife.
Okay.
That meant I didn't care. That meant I wasn't worthy. That meant I wasn't a good wife, which is absolutely far from that. They're not related at all. But that executive dysfunction has persisted, right, with the car not being clean. And my new boyfriend a few months ago was like, he got in the car and he was like, oh, Amy, your car's dirty. And I immediately was like, it doesn't make me a bad girlfriend. It's not related to any of that. And I just went off on if you have a problem with it, you can clean it, you know. And he was like, whoa. And I'm like, just so you know, they're not, my executive dysfunction does not make me a bad girlfriend. It doesn't make me a bad parent. It doesn't make me a bad provider.
So that having your car dirty and then having someone comment on that over and over has created this path in your mind that automatically takes you to that negative as soon as you hear somebody say it.
Without question. Almost like a trauma response.
Yeah.
I was triggered. But that's how it goes, though. People use those moments of executive dysfunction to say why we're not good enough, why we're not capable, why we're not worthy of whatever it is, whether it's even love.
Yeah. Or jobs.
I
think about, sometimes, certain jobs, certain executive functions go along with that, and we see people that, or maybe we personally experienced it, that can't make it up the ladder just one more step because that executive function just isn't there. And unless you kind of like create a new pathway around it, it's hard to get past that. It's hard to, you beat yourself up for it. You can't get the job promotion maybe, or whatever it may be. But those can really create some major issues as far as what we feel towards ourselves.
Well, and I think it does shape self-esteem because we see our peers being able to function better just on a different level, and it hurts.
Yeah.
because we're smart.
Mm-hmm.
We should be able to do all of those executive functioning things.
Mm-hmm.
And it doesn't always work out that way.
Yeah. What about, like, so I think when I think about executive function, sometimes I feel like sometimes we can hide our failures of those executive functions. Does that make any sense?
It does.
So
Because we
like,
compensate well.
we do.
I mean,
And
someone from the outside doesn't know my failures.
yeah. But if you knew me, like, you know, this one thing is my, like, that's the executive function that I don't have, but I've managed to find a way around it so people don't notice it. I don't know if everybody else felt like that too. Because I feel
Well,
like
and
that.
I do think we compensate well. No one, I don't believe that people, unless I'm wrong, so you tell me.
Okay.
I don't think you or any, like, people I work with, people I've met, I don't think my patients necessarily see the level of my dysfunction.
No, I agree with you totally. Because we do. We cover it up. We
cover
mask
up. I mask well. I figure it out. I have systems in place that fix the issue.
Yeah.
And what I haven't been able to fix with an accommodation, I just am then now super sensitive about.
Yes, exactly. Yeah.
So,
but I think that's a really great point though, because so what you just explained was, you said that you've created systems around that executive function that you can't get. In all reality, you've created new executive functions. You just don't use the one that's normal for everybody else to use.
Right.
And I think that's great. And I think you should be applauded for that. I try to tell my patients that find a way around that normal executive function and find something that works for you.
Right. And when we've talked about it before, like paying bills.
Yeah.
I can executive function and go to the website, and I can set up all the auto pays, and I can do all of that, and I can executive function. My calendar is fine. I don't ever, well, I hate to say never, but I don't overbook myself.
Yeah.
I've never messed up and overbooked shifts on each other. So I always make sure I have the money in my account. I pick up extra shifts to always make sure I have my auto pay money. So there are some things that I do really well. I'm never late to work.
Yeah.
Well, unless there's like a car wreck, like something extraordinary. And I think that's happened once, and it was because of an extraordinary car wreck. It wasn't, I'm not late to work. Even personal care.
Yeah.
I do shower. I hate every second of it, but I get it done, and I accommodate for myself, and I do get it done. It's just, to other people, they may not see the struggle that's there because I compensate well.
Well, and I think so many of our struggles, just like the not liking to shower. I mean, until I really got into this and got deep into knowing people with ADHD, autism, like, I didn't realize that was a thing. And I think what sounds so abnormal to some people, that you don't like to shower, like, you start to realize, wait, there are certain things that we don't like to do as ADHD people.
Right.
We look like we're outgoing and we want to do all the things all the time, but little things like that can be very, like, overstimulating.
Without question. Without question. It can be too much.
Yeah. Speaking of overstimulation, feel like as you've gotten older with your ADHD, and I'm very much an extrovert, always have been. And as I've gotten older, I feel like I'm more easily overstimulated than I used to be. I can't do the extroverted things that I used to be. Do you see that in your patients or yourself or anyone else that you know that has ADHD?
I absolutely see that, and I think it has more to do with the demands are just so much greater. So that leaves our ability to put up with overstimulation a lot less.
Okay.
So we'll see a difference between a mom who has one kid who handles, doing great. They're doing great. They're surviving. They're making it. But by the time they have 3 kids, they are done. They are just over. The demands just outweigh any of their coping skills.
Yeah.
And I think that's what happens as we get older too, especially when we talk about, like, us in perimenopause, where estrogen is down, dopamine is down, and now things just are a lot more overstimulating than they were. So I could easily, 20 years ago, go to a concert And now the thought of going into a crowd with a whole bunch of people
Yeah.
doesn't even sound like fun. Like just the thought of being like having all that noise, I just don't even,
Yeah.
like that's not
Yeah.
my normal, like that's not something I could do on any regular basis. That would take a lot.
Yeah.
It's not that I don't ever want to go,
It's just,
but that's not something I could do on
yeah.
a regular basis.
Yeah. I've just found over the years that I very much was that person that I could go. Like I wanted to be around people all the time. I wanted to always be doing something, and specifically like doing stuff with other people. Like I love to be, with my spouse or with my kids or with my friends. Like when I was younger, like I always wanted to go, be with people. And I've found that as I've gotten older, like I don't want, like I'm like, oh, can we just stay home tonight? Like I don't want to do that thing.
I definitely feel that.
Yeah.
And I think I like myself a lot more than when I was, 20 years ago.
I agree. Yep.
And so I think I was always looking, it wasn't that I necessarily wanted to be with other people, but I think that was the expectation. It was like if you didn't have 30 friends, if you didn't have a boyfriend, if you didn't have all of this extracurricular stuff going on, then you must be lonely.
Yes. Okay. That makes sense. Yeah.
You must be sad. You must be missing something. And now that I'm older, I go, oh yeah, no,
Yeah.
I'm fine.
Yeah.
I actually like my alone time. I don't need another person to make me happy overall.
Yeah.
I mean, I enjoy people's company, but even my boyfriend will parallel play. He'll sit and watch TV or whatever, and I sit and do what I do, read or look at my phone, and that's good for me.
Yep. Yeah. No, I'm with you. I think I agree. I enjoy being able to enjoy the quiet or the space of just my husband and I sitting, and he's on his phone, I'm reading my book, but it's just we're there together, but without all the chaos, I guess.
Yeah, I like together. I don't like the performative having to meet people's expectations.
That's a good point.
I'm not good at it.
Yeah.
And it takes a lot to do.
Yeah.
And so I just don't.
Yeah. And I think some of it's wisdom too. We learn to sit back and not necessarily have to be in the mix of things.
Right.
Because we see a different side of it as we get older.
And I don't require, and maybe it's the autism, I don't know.
Yeah.
I just don't require people the way it feels or appears that other people require people.
Yeah. Yeah, I agree.
And I don't know exactly what that is.
That's interesting. ADHD conflict styles.
Oh.
Are you a shutdown or an over-explainer?
I think I'm an over-explainer.
Okay. I'm a shutdown.
I am an over-explainer because I think I'm trying to explain my thought process, and I want that from other people. I want an explanation.
Yeah.
And so if somebody shuts down, I'm left looking for just an explanation. I'm not even trying to be in conflict. I just want an explanation.
Yeah.
So I think overall I'm an over-explainer.
Okay.
You shut down? That's shocking to me.
I think in some situations, I would say sometimes I want to over-explain because I want to explain why I did what I did or why I'm doing what I'm doing, or like, let me give you my version. But in the midst of like, if it really boils down to it and I'm not getting through, I'll just shut down.
Okay. Well, and I guess I'm sitting here thinking, well, you and I don't ever have conflict.
No, yeah.
So.
Yeah. Yeah, no, a shutdown, if you ask my husband, he'd probably say I'm a shutdown person. It's actually a really bad trait to have because it causes more issues in the long run because I just won't say anything because there's no point in starting a conflict or, I'll just deal with it type of person sometimes.
Well, and I think for a lot of, like, for some stuff I'm like that for sure. I'm just like, it's not big of a deal or it's not worth it to me to, to start conflict.
Yeah.
But if there's already conflict, I want answers.
Yeah. So I didn't ever try to get myself in any conflict. I just wouldn't have a conversation with you. It just let push it under the rug type of thing. So I would say that's more of that shutdown, like just brush it off, pretend like it didn't happen.
Yeah.
And that can be really detrimental to relationships if you're
Well,
not careful.
especially if it builds into resentment.
Mm-hmm. Yeah. So I've learned as I've got older, I don't do that quite as much anymore, but that used to be my tendency.
And I can see, I mean, in my personal relationship, I can see where my over-explaining and wanting explanations from others is definitely not how my partner is.
Yeah.
But that's, like, I struggle.
Yeah.
Conflict is tough.
It is. And I think it gets really tough when you have two different, really different personality types, especially. So, you've got, and they both could be ADHD people, but one is the over-explainer and one's the shutdown. Because if you don't know how to handle the other person's over-explaining, it seems like lecturing.
It looks like an excuse.
Oh, okay,
So I'm an over-explainer, and like in previous relationships, it was an excuse.
Yeah.
Well, I don't want to hear your excuse. Oh, I'm not excusing anything.
Yeah.
I'm telling you this is why I did what I did. It's not an excuse.
And I feel like for me, I've probably got some rejection sensitivity issues, so it sounds like lecturing to me.
Yeah.
And so I'm like, why are you lecturing me like a kid? So yeah, that definitely, conflict can be rough. Well, thanks for joining us. If you have questions or comments, please drop them down below, and we'll see you again back here
Next Tuesday.
next Tuesday on Stir Crazy.
Bye.